Okay. May I know your name, dear?
Sumaya.
Okay. So, Sumaya, your 2 minutes starts now. 2 more pages.
Next page. Next page. Any other page?
This is third page. First or second? Started your 10 minutes time.
Okay, hi, I'm Dr. Sumaya, one of the doctors in the gynae clinic today. May I confirm your name and age, please?
I'm Jess and I'm 26-year-old.
How may I address you?
Oh, Jess is fine.
All right, Jess. So I have gathered from your case note that you are here to discuss issues regarding excessive hair growth on your face. Am I right?
Oh, yeah, doctor.
Sure, Jess. We'll discuss your concerns. Since we are meeting for the first time, I would like to ask few more questions to know more about you, and then we'll make a safe management plan for you. Will that be okay?
Yeah.
All right, Jess. Please tell me more about your concerns.
Actually, doctor, I'm 26-year-old. And since the beginning only, because my periods are pretty irregular, I'm having this complaints of having excessive hair growth. Okay. And it gives me a very low esteem, low confidence. I feel ashamed of myself. Uh, and at a time, I don't know, I try to avoid people. I try to avoid social gatherings. So I visited a GP and he suggested that I need to come and see you.
Sorry to hear about this, Jess. Where exactly do you have excessive growth on your body?
Yeah, I do have the excessive growth on my face, especially my chin, my mustaches. Recently, I have noticed the excessive growth on my chest also and on my tummy also.
All right. Have you taken any treatment before?
For my facial here, I used to shave it, but now the hairs are very thick and very prominent.
So how frequently do you shave?
Yeah, every third day I used to shave, so now it's my skin is also very rough.
All right. And do you have acne apart from this?
Yeah, I do have excessive oily skin and acne also.
All right. Any weight gain?
I'm little on a plumpier side. So yeah, I am always on this this way. My BMI is my weight is as at present 80 kg.
So, have you considered losing weight, or do you find difficulty in losing weight?
I find it very means and distressing to lose weight. It's not easy for me.
I can understand, Jess. And do you have any marks on your neck or any darkening
Yeah,
on your?
yeah, I do have that also.
All right. Any difficulty in breathing during sleep?
No,
Okay, Jess, since you said you had irregular menstruation, so what exactly the irregularity is? How can
I
you more
always
elaborate?
get my periods every 2 to 3 monthly. I do not take any pills for withdrawal, but yeah, it's pretty irregular, doctor. Many a times it's very irregular. I haven't tried any treatment for that.
All right. And did you have your smear done?
Yeah, it's normal.
All right. And when was your last period, Jess?
It was 2 months back.
Okay. Some questions may be intrusive to us, but are you do you have a partner, or are you sexually active?
Yeah, I am in a sexual relationship with my boyfriend.
Okay. And any history of sexually shared infections in the past?
No,
Okay. So do you see your GP for any medical illnesses?
no,
Any surgery on your tummy or down below?
no.
Any family history of concern that you would like to share,
What
or any
family
similar
history?
condition in the family?
No, doctor. No.
Okay. Do you smoke?
Yeah, I do smoke two means 3 to 4 cigarettes a day.
All right. So, you know, Jazz, smoking is not good for your health. Have you ever thought of quitting?
Mhm. I haven't yet, doctor.
Sorry?
I have not yet thought of it. I will think about it.
That's nice. Do you take alcohol, Jazz?
No, occasionally in the parties, not regularly.
Any recreational drugs?
No.
What do you do for your living?
Uh, I am actually working in a law firm.
Okay. And how have you been feeling lately for the past 4 weeks?
Not 4 weeks, doctor, but this has affected my self-esteem. I am not able to carry myself with that confidence. So yeah, it's very difficult for me to do day-to-day activities. I really wanted to know what's wrong with me and why these hairs are there excessively.
Surely, Jess, we'll definitely discuss about it. And if you want, I can connect you to a counselor or a support group with whom you can discuss, and you will feel better with it. Will that be right?
Yeah.
Okay. Uh, Jess, if you don't mind, I would like to examine you in the presence of a chaperone to have a look on the hair growth on your body and to have a look on your tummy. Will that be all right?
Okay.
Yeah. So, Jazz, what since I have examined you, and what I have come to a conclusion is, before giving you the final diagnosis, there are certain tests that needs to be carried out on you to find out why there is excessive growth on your body. So these are some hormone test and an ultrasound on the abdomen, and an ultrasound to have a look on your womb and the egg baskets. And what I think after examining you is that you are having a condition which is called polycystic ovarian syndrome, and this excessive hair growth is associated with the hormone imbalance, and this term is called hirsutism. Have you ever heard about it, Jess?
Okay. No,
So
I have heard about PCOS, but I haven't heard about hirsutism.
I'll guide you with it, Jazz. So, what we are going to offer you is that your management will be under a team of doctors that would include a gynecologist and an endocrinologist. Endocrine is basically the hormone specialist, and a psychologist and a dietitian. So, there are multiple treatment options that we can offer you. The first is the lifestyle modification, then there are certain medications, then there are cosmetic measures that can help you with getting rid of these excessive hair growth. Um, are you with me, Jazz?
Okay. Yeah.
So, with lifestyle modification, since your BMI is on the higher side, we would like to offer you, I will connect you to a dietitian and who would help you in guiding you for a proper meal, a healthy balanced diet, and will also connect you for supervised exercises that will help you control the hormone levels and that will help you in reducing weight. Then there are certain medications. These are the hormone pills, and they are basically taken for daily for like 3 weeks and at least for 6 months. This will help you in not only regularizing your menstrual cycle, but also will help in the reduction of the hair growth. But there are certain side effects that you must be aware of. That those are sometimes headache and fatigue, and there is also sometimes increased risk of clot formation in the body. To prevent that, you need to keep yourself hydrated.
Okay.
And then there are medications that are called water tablets. These are basically spironolactone. This, as what happens is, this reduces the hair growth on the body, but it may cause imbalance in the salt and potassium in the body. And you also need to take some contraceptives when you take these medication, because it may cause abnormality in the baby if you get pregnant. And after that, Jazz, there are cosmetic measures. These are creams and gels, and then there are electrolysis and laser. So these cream and gels are basically there's a cream that is called Venica, and it reduces the hair growth,
Okay.
and that is applied on the face, and twice daily for at least 4 months. And the effect will be seen after 6 to 8 weeks of the use of that cream. The side effect is that when you stop using that cream, you will have regrowth of hair on your body. And then there are measures which is called electrolysis and laser. These are basically not supported by the NHS. They are quite
Doctor,
expensive.
I do have one more concerns. See, I'm involved in a sexual relationship with my partner since very long. In spite of not using any contraception, I didn't conceive. So, will I be able to get pregnant? And that is also a big question for me.
See, Jazz, you're not able to get pregnant because your cycles are not regular, and to regularize this cycle, we can help you with these hormone pills, and even if you lose 5% of your weight, then your cycle gets regular, and then you'll be able to conceive. So the basic problem lies in the hormone levels, and that can only get back to normal once you lose weight. So if the cycle gets better, then obviously you can conceive. There's no difficulty in getting pregnant then. Are you with me, Jazz?
Okay. Okay, got it, doctor. Thank you.
Sure. So I'll give you some patient information leaflet. You can go home and read about these options, and then come back to us, and then we'll prescribe the medications to you. All right, Jazz.
Okay, thank you, doctor.
Thank you.
Okay. So, your own reflection.
I don't know.
Okay, anybody would like to comment on her performance? Please, girls, come up. Giving a good feedback is also means finding out the mistakes, finding out the positive things, okay, about that performance, and taking yourself in that direction. Okay, so I know what exactly one need to do. So please come up, answer.
They were sleeping. She
Yes,
did
dear.
nicely, ma'am, but yeah,
Yeah, did
she
nicely.
did nicely. But I think the management maybe from conservative to
Yeah, she
the
has
drug.
changed the sequence. Okay, she has changed the sequence. Now tell me what you had been asked to do in 10 minutes. Listen to those points, okay? Mark those points. What have you done?
The causes of hirsutism should have been explored more.
Yes. So PCOS is a diagnose is an PCOS is a diagnosis of exclusion. Okay. Uh, very means looking at the situation, yeah, it is PCOS, but still you have to rule out other abnormalities because of her hirsutism. So you just need to say one sentence looking at your history. This hirsutism is mostly because of the polycystic ovarian syndrome, but still I would like to do certain tests to rule out any other abnormalities, like any means any ovaries or adrenal glands which is secreting more of a male hormone or androgenic hormones. Sometimes there is a condition known as congenital adrenal hyperplasia. That means the thickening of the adrenal gland secreting more of the testosterone. Just to simplify the situation, okay. Idiopathic. One of the reason is idiopathic also. So we just need to at least two or three differential diagnoses, dear. Hmm? Okay.
Right,
Then
ma'am.
treatment options will be from conservative to definitive. Hmm? So that is what actually needed in this case. Apart from that, most of the history was relevant. Again, you started asking, combining two questions at a time. When you think that, oh shit, I am running out of time, you started combining the questions. Avoid that. Mm, specifically, you asked at history is totally irrelevant in this task. Hello.
Yes, ma'am.
Okay, so STI history is totally irrelevant in this task. Apart from that history, means rather than that history, contraceptive history and pregnancy history is very important. What contraception you are using? Are you planning to have a baby? Okay, because then you can guide her accordingly. Uh, then okay, so examination, very nicely you offered me examination, and then you started explaining me what is hirsutism, what is PCOS. So PCOS is having a support group name as, anybody can name the support group of PCOS. Please, girls, try to take a name of the support groups, at least commonest of common support group. They wanted you to take a name. PCOS, Verity. Okay. So Verity is a support group name for PCOS. Try to take a name. Here, little more thing, a little more concern. What I had was, she is depressed. She is a girl who is finding it difficult to cope with the outer world. So I wanted to listen few reassuring words or something, means something regarding that situation. Okay. Yes, women do find it difficult. A woman with hirsutism do find it difficult to go outside. They may have a low self esteem, but mingling with the similar people who are facing the similar situation, sometimes a counselor will help you to come out of this feeling. Okay, will help you. And it's not one time. Okay, it's not going to come go at a time. It's a slow process. Yes, all the treatment will take time to act. Mm? She needs to put her efforts to get a good result. That is very important here. So this is what I wanted to listen to, those two, three sentences regarding my difficulties. Uh, so confirm aim of consultation GP. It is GP. It is not case detail. Okay. If you are having a GP, please mention that GP states that excess hair growth. She might be a year onward only. She will not open up with you. She will have that feeling of self neglect, low esteem, loss of confidence. So if you are thinking that you are dealing with such kind of patient, in the beginning only you just tell her that whatever we are going to discuss, it's going to be confidential, and I will encourage you to express yourself so that we will able to manage you in a better way. At least one or two, three situation. Her embarrassing situation, say treatment op, yeah, we do acknowledge that it might be embarrassing for you, and you are facing means you are facing a difficult phase of your life, but we will discuss the treatment options. Okay, we will discuss the treatment options which will be suitable in your case. What is wrong with me? Okay, so that is my first concern. You forgot to ask me the concern. Okay, my first concern is what is wrong with me. Setting agenda. Open question regarding excess hair. Yes, you asked me. Treatment tried, you asked me. Any other body parts, you asked me. Any medication, you missed out on that. Are you on any medications? Hmm? Weight
Ma'am, I
loss, weight,
asked
what you
taken.
asked? Weight gain, weight loss, you asked. Medication, you didn't ask me. I didn't listen to that medication. There are certain medications which also causes hirsutism. Yes or no?
Yes.
Okay. Steroids. Steroids, anabolic steroids, then phenytoin. So there are certain medications which are more prone for causing hirsutism or excess hair growth. Minoxidil. Okay. So you just need to ask, are you on any medicines? Weight gain, weight loss, any voice changes, because we need to know whether it is what are the anticipated levels. Okay, so voice changes, that means it is totally androgenic and it is not PCOS. If voice changes are not there, then it is PCOS related to that. Okay, oily, greasy skin, acne, you asked me. Menstrual history, you asked me. I am not getting periods since last 2 months. Did you offer me UPT?
No.
When I'm there, only offer me UPT. Okay. Okay. Treatment right for the
Yes.
same. What contraception? It's very important. Family member, history of similar condition in the family member. Okay, very important, because then that CH and all those things will be familiar. Okay. Medical history, especially high blood pressure, headache, breast discharge, any surgery in the past, especially on abdomen. Okay. Mental history, very important. You asked me low down, depressed. Okay. Sexual intercourse, difficulties, support and occupation. Offer examination. Pulse, blood pressure is very important here. Why? And means any adrenal gland tumor will have a high blood pressure. Okay. PA, per speculum per vaginal examination. Per speculum per vaginal is not important, but per abdominal examination is important to check for any masses. And then calculate a special score, which is known as Ferramin Galway score for grading the excess hairs. Okay, and this will also help us to treat you according to the options. Hirsutism, what having a excess hair growth in a male, like hair male pattern. Okay, what is this male? Okay, so this is not a male. Okay, male pattern hair growth or excessive hair growth is known as hirsutism. So many reasons are there. Many reasons are there, and in your case, most probably it could be PCOS. Okay. Sometimes we may able to find out the result. Sometimes it's a idiopathic or unknown reason. Uncommon, but there might be uncommon reason like idiopathic. That is no reason, but due to irregular cycles. Okay. So irregular cycle, hyperandrogenism, we are labeling it as a PCOS. You checked my background knowledge both the way. Okay, so hirsutism and PCOS, you checked my knowledge. So PCOS, what is PCOS? You have to explain me the implication of PCOS. So it's a condition which affect your physical appearance, your menstrual problem. You may experience menstrual problem, fertility problem due to hormonal imbalance, and long-term complications like diabetes, heart attack, means heart condition, obesity, sleep apnea, and sometimes even the mental mental disturbances are also there. Okay, so yes, this is what we are thinking in your case, but we also need to keep in our mind other differential diagnosis or other probable causes of this condition, like any tumor which might be secreting this male hormone, or condition which is where there will be a adrenal gland hyperplasia, diseases of thyroid, adrenal gland, acanthosis nigrans, okay, hyperandrogenic insulin resistance, acanthosis nigrans, or sometimes the drugs. At least two or three you need to tell. I had mentioned so many because you might get similar situation or similar task in the exam, and that's the reason I had mentioned everything in this differential diagnosis. But at least two differential diagnoses along with this PCOS you need to mention. Any two. So we need to know exact cause, and that's the reason we would like to investigate. So hormonal profile: FSH, LH, prolactin, TSH, free testosterone, SHBG, 17 hydroxyprogesterone, and USG. Okay. In over Now coming to the management. So yes, overweight woman with PCOS needs to manage with the help of lifestyle modification. Then medical or hormonal. Weight reduction is very important. Here you are going to involve the dietitian. Okay, dietitian and weight management groups you are going to involve. Okay, if I have not tried anything to minimize the weight, to reduce the weight, yes, it is difficult to lose weight on your own, so you can involve a weight management groups. PCOS people, we do generally offer them. Okay, so 5 to 10% of reduction in weight will help you to minimize the hirsutism by 40 to 50% within 6 months of loss. This is the sentence from the talk. So this is very important sentence. What I find it out, I think one can really use this sentence to make impact of weight loss on a role player. Multidisciplinary team, MDT. So yes, you had taken the name of all the MDT people. So consultant, gynecologist, endocrinologist, exercise, that is exercise team, dietitian, and psychologist. These all will be a part of your team, and we need to diet and exercise first line of intervention over a period of like 6 months. Along with that, cosmetic method. Okay, so the next will be cosmetic method, where she can use routinely the less more commonly available, less costlier methods like threading, bleaching, waxing, plucking. Shaving may lead to excess blunt hair. Okay, and the skin will be also raw with the help of shaving. Alternative will be laser hair removal or electrolysis, but these are painful, although they are having a but less painful and a less side effect, but they are costly. Okay, so this method, like laser hair and electrolysis, they are little costly. Now coming to the next line of management, that is hormones. So hormones will be newer progesterone containing pills, which is not having a androgenic effects. Okay, so they are anti-androgenic, and on the top of that, if you are not keen to conceive, then it will act as a contraception also, ongoing contraception, drosperinone. Okay, COCP, that is Dinate, is another cytotrione acetate. Okay, cytotrione acetate is another drug or another pill which can be used and which is also be utilized for this excess hair growth treatment, in the excess hair growth treatment. So there are hormonal methods. So here I had mentioned about how they act. uh, in COCP reduces free, you do not need to tell this to the role player, but just for our own knowledge I had put this slide. No need to tell what treatment you are going to tell, because they just wanted to listen to that MDT, weight loss, dietitian, cosmetic, simple cosmetic, costly cosmetic, then hormonal modalities. Okay, hormonal modalities will be COCP containing newer progesterone, that is drosperinone or cytoprene acetate. These are the modalities which you can say. The mechanism of action of COC will be they reduces free plasma testosterone levels. The progesterone component suppress LH and thus androgen production by the ovaries. So LH is a major stimulus for androgen production. Estrogen component also increases SHBG production by liver. So SHBG will be raised, so the free testosterone will be less into the circulation. Although the COCP will not reverse hirsutism, but it can reduce the need for shaving by 50%, and it may halt the progression of the condition. Then anti-androgen is androgen containing tablet like spironolactone or water tablet, what you had mentioned. Then another names as flutamide and finasteride. So these are the names which you can take if you think you are having time. If not, hormonal medication, COCP containing neuroprogesterone, that is drospirenone and cytopteran acetate is sufficient enough to give you a marks. Okay. Then there is a cream which is known as eflornithine cream, which acts by inhibiting the enzyme ornithine decarboxylase. Okay, so this needs to be applied on your skin daily. Side effects are available, are there. They will. It is licensed for use in the face, and I thought to act. It thought to act on the hair follicle to reduce the rate of growth by inhibiting keratin producing synthesis. Okay, only recommended for tropical use. Can and woman can apply moisturizers or cosmetic on the top of the cream, which is rapidly absorbed by the skin after 5 minutes. So these are the this slide is only for knowledge purpose. You can skip this slide. If the role player is having any specific concerns, then only you can explain what are written in this slide. Okay, otherwise you can very swiftly skip this slide. So treatment for hirsutism, this is very important now. Okay, treatment for hirsutism is lengthy. It can be expensive at a time and painful. It can have adverse effect and may not be instantly satisfactory. Okay, so this is a slow treatment. It is important to ensure that women on anti-androgen also use effective contraception. This is patient safety points. Okay, efficacy may be improved by combining therapies such as cosmetic therapy, hormonal manipulation in the presence of obesity, weight loss. So all these will be the last sentence. This sentence is very important. Please ensure that you will use this kind of words in your consultation. It's not a quick relief. The patient might not be getting a quick relief. Fertility, yeah, as it is associated with anovulation, losing a weight. Okay, losing a weight will definitely help us to get pregnant. If at all why she feels that it is she's finding it difficult to get pregnant, then we can involve fertility expert. Okay, counselor, mental health support team is very important since low self-esteem. Okay, referral for endocrinologist, inform consultant, close the loop. PIL of hirsutism, PIL of PCOS, and support group, that is verity. Okay, and you have to write back to the GP. Okay, close the group loop by writing back to the GP. So very nicely done, dear. Very nicely done. Now coming to the information gathering, associated symptoms of acne, weight gain, acanthosis nigra, and irregular period. Family history, exclusive factors, drugs or other medical problem. You missed out on drug, other medical problems you asked. Biochemistry, they had mentioned depend, especially in follicular phase. So you can mention that. In the first half of the cycle, you need to do all this test. Okay, ultrasound scan you mentioned, examination you mentioned. So clear pass in information gathering domain. Communication with patient and families, introduce self and role, explain the possible diagnosis, that is PCOS, but differential include iatrogenic, familiar, adrenal tumor, discuss investigation, LH, FSH, testosterone, SHBG, ultrasonography. Okay. Explain treatment options. What are the treatment options? You explain me. Implication you missed out. Okay. So having this condition, having PCOS, what it means? Still, I am giving you clear cut pass in this domain also. Communication with colleague, clear pass because you had mentioned all the uh, colleagues. Okay, patient safety, confirm patient details at the start, acknowledge her concerns, low self-esteem, offer counselor support group, discuss contraception, discuss weight loss, pros and cons of the method, counsel about long-term medical implication of the pathology, rule out serious condition, counsel on medication and pregnancy including on risk of medication. I'm little bit strict in this domain, so I'm giving you borderline in this domain. Okay, applied clinical knowledge, knowledge about PCOS, knowledge about differential diagnosis, a knowledge about treatment modality. So here also I am giving you clear pass. Any question anybody has having? Anybody's having any question?
No, ma'am.
Clear?
Yes.
Yeah. Was
Yes,
I audible throughout the conversation? Or the...
yes, ma'am.
Yes, or
Okay. Okay. So very well done.